Assalamu alaikum. Today we will begin a new region in anatomy, which is the thorax, منطقة الصدر. In this video we will cover the introduction to the thoracic region and the thoracic wall. هذه الصفحات راح تلقوها Gray's Anatomy for Student كتابكم المنهجي fourth edition. نهاية الفيديو المطلوب من عندنا انه نفهم الثوراسيك ريجن، شنو هو الثوراكس، الامتداد مال الثوراكس boundaries, the general features of the thorax and its relation to other regions. نفهم في شيء اسمه thoracic wall, what are the elements of the thoracic wall, and we will study in details the skeletal elements of the thoracic wall. And thoracic wall basically composed of muscle and bones, so we will study the skeletal elements, the bones اللي نسميه thoracic cage, القفص الصدري اللي متكون من sternum, ribs and thoracic vertebrae and their articulation of these bones. طبعا نعرف شلون نفرق and how to classify the different types of ribs and vertebrae, وشلون نميزهم وشلون نصنفهم. وأخيرا we study the breast اللي هو one of the covering of the pectoral region. والpectoral region هي the region that cover the upper anterior aspect of the thoracic wall. Other details of the pectoral region we have already studied in the subject of the upper limb. One more thing to mention قبل ما نبلش، أول موضوع بالثوراكس راح تشوفوه بكتابكم هو conceptual overview. يعني تفاصيل طويلة وعناوين هواية. اللي نريد نغطيه بهذا part هو بس شغلات اللي راح نحكيها. بقية التفاصيل راح ندرس كل تايتل راح ندرسه as an individual video، راح ندرسه كفيديو بحد ذاته وندرس التفاصيل مالته. What is the thorax? The thorax is the region that lies at the upper part of the trunk. It extends from the root of the neck superiorly down to the abdomen inferiorly. It has an irregular cylindrical shape, شكلها اسطواني غير منتظم, has a narrow superior opening, نسميها superior thoracic aperture, and a relatively large inferior opening, نسميها inferior thoracic aperture. Superior thoracic aperture allows a continuity with the root of the neck and the axial limb مثل ما راح نشوف relations to other regions, while the inferior thoracic aperture is sealed off, مسدودة بA musculotendinous organ or structure called the diaphragm, الحجاب الحاجز. So the inferior thoracic aperture اللي هي تتصل لي مع الابdominal cavity راح تكون مسدودة تماما وتماما بالضبط مثل ما راح ندرس ب musculotendinous structure نسميه the diaphragm, separating the thoracic cavity from the abdominal cavity. بوجود الدايفرام ووجود thoracic wall اللي يتكون لي من muscles and bones, هذه البونز نسميها ribs. This is the sternum that you should be familiar with, and posteriorly we have the vertebrae, the thoracic part of the vertebrae. راح نقسم the thoracic cavity into three compartments. On each side, right and left, pleural cavities that contain the lungs. plural يعني غشاء الجنب اللي هو mesothelial membrane that covers the lungs and lines يبطن the thoracic wall from the inner aspect. In the middle, between the two pleural cavities راح يصير عندنا هذا middle partition نسميه the mediastinum. Mediastinum lies between the pleural cavities and separates them from each other. هذا موجود middle part, contains the heart, contains the esophagus, trachea, major nerves and major blood vessels. ومثل ما قلنا pleural cavities تحتوي على lungs. طبعا هذول the three partitions they are separated from each other, allowing إذا any lesion in this pleural cavity cannot be transmitted or transferred to another pleural cavity. مثلا إذا صار عندي cancer in one lung ما راح نتوقع إنه هذا lungs ممكن يتصل to the contralateral to the other lung or pleural cavity. من جهة ثانية إنه any abnormality in the mediastinum مثلا نجري عملية جراحية بالميدياستينم, we can enter the mediastinum without opening the pleural cavity. What are the functions of the thorax? The main and most important functions is breathing. The thorax provide the machinery الميكانيكية اللي بيها أحتاج يصير عندي breathing. هذا البريذنج يسمح لي بدخول وخروج الهواء, let the air in and out of the lungs to provide oxygenation to the blood. فهذا breathing. Second important function is to protect the vital organs in the thoracic cavity. مثل إيش؟ The heart, lungs, important structures in the mediastinum مثل esophagus المريء, trachea, القصبة الهوائية, the major nerves and blood vessels. And lastly, it acts as a conduit. Conduit يعني ممر اللي راح تمر به structures from the neck to the abdomen and vice versa. And of course طبعا some structures from the neck to the thorax. What are the relations to other regions? Thorax has relations to three main regions اللي هم neck عن طريق superior thoracic aperture, the upper limb عن طريق axilla عن طريق the inlet of the axilla, and to the abdomen through the inferior thoracic aperture, which is sealed off by the diaphragm. With the neck, the thorax has a close relations to the neck, and as you can see, the superior thoracic aperture is bounded by anteriorly the sternum, the upper part of the sternum, the semi-manubarium sterni, on each side by the inner border of the first rib, and posteriorly by the anterior part of the body of the first thoracic vertebra. الشيء المهم اللي نشوفه هنا انه هذا superior thoracic aperture, it's continuous with the root of the neck. The pleural cavities هذه البنفسجية نشوفها انه هي تصعد above the level of the first rib by about 2 to 3 centimeter. So the pleural cavity and the lung, consequently the lung بالتأكيد راح تصعد above the level of the first rib. This is the first rib that articulates anteriorly with the sternum and posteriorly with the first thoracic vertebra. اللي نشوفه انه البلورا تصعد above the level of the first rib وممتدة إلى root of the neck. فطبعا عندي منها pleural cavity, منها the apex of the pleural cavity on the lung, apex القمة, و on each side وبالنص important structures are bounded by the pleural cavity. Pleural cavity المستوى ما تصعد above the level of the first rib to the root of the neck, وبالنص هو structures مثل ما قلنا. هذا هنا شيء شوفك إنه any abnormalities, any events that happen in the root of the neck might affect the apex of the pleural cavity and the lung. مثلا injury صارت بالroot of the neck ممكن تأثر لي على apex of the lung and pleural cavity. والعكس صحيح. Any abnormality or any events that happen in the root and the apex of the lung could affect the structures in the root of the neck. Relations to the upper limb, as we remember that the axillary inlet اللي هو triangular in shape, bounded anteriorly by the clavicle, superior border of the scapula and the outer border of the first rib, يمثل لي مدخل الأكزيلا. هو triangular in shape يكون مدخل الأكزيلا، فهذا يكون on each side of the root of the neck. The relations with the thoracic cavity, some important structures that emerge from the thoracic cavity goes above the first rib and enters into the axillum. It is subclavian artery, subclavian veins, and of course there are some structures اللي came from root of the neck. You remember the brachial plexus هنا وتدخل إلى الأحزلة. فهذا another close relation of the upper limb with the thoracic cavity. And lastly, we have another relations of the thoracic cavity with the lower abdominal cavity that are separated by the diaphragm. وهذا الدايفرام موجودة which is a musculotendinous structure, has several openings at different levels بمستويات معينة, at different vertebral levels. تدخل بها important structures transmitting and transiting from the thorax to the abdomen and vice versa, from the abdomen to the thoracic cavity. The superior thoracic aperture is bounded completely by skeletal elements, posteriorly by the body of first thoracic vertebra, T1 vertebra, on each side by the inner border of the first rib, and anteriorly by the superior margin of the manubarium sternum. The plane of the superior thoracic aperture is not straight, is not horizontal, it is oblique. It has an obliquity, bimayalan, because the first rib lies in oblique plane from the first thoracic vertebra, articulation with the first thoracic vertebra posteriorly, to the articulation anteriorly with the manubarium sternum through the costal cartilages اللي راح ناخذها later on. This obliquity, هذا الميلان راح يخلي لي إنه upper part of the pleural cavity, الجزء الأعلى نسميه apex of the pleural cavity that surround the lungs وداخل lungs will extend above the level of the first rib. وراح تصير on each side of the entrance of the superior thoracic aperture. The structures, طبعا it has a continuous course with the root of the neck. It is not sealed by any structure. In the middle aspect of the superior thoracic aperture, important structures passes from the neck to the thoracic cavity and vice versa, اللي هم esophagus, المريء, the trachea, القصبة الهوائية, and major blood vessels. The major blood vessels of the upper limb passes and curves superiorly and laterally above the levels of the anterior part of the apex of the pleural cavity, شوفها, and it curves above the superior surface of the first rib. The inferior thoracic aperture, however, it is wider, it is bounded by bone, cartilage, and ligaments, so it is expandable, ممكن يتوسع, compared to the superior thoracic aperture. It has an opposite direction of obliquity, الميلان مالته عكس الميلان مال superior thoracic aperture. Superior thoracic aperture directed downwards and forwards in an oblique fashion, while the inferior thoracic aperture directed upward and forward. It is sealed by the musculotendinous structure, the diaphragm, and separates it from the abdominal cavity. The thoracic wall is a musculoskeletal wall that encloses the thoracic cavity, composed of muscles and bones. The bones here, anteriorly we have the sternum with 3 parts of the sternum, to which 12 pairs of ribs are attached, 12 on each side, through the costal cartilages. الربس راح تتصل بالسترنم عن طريق cartilages اللي هي hyaline cartilage نسميها costal cartilages. And posteriorly you have 12 thoracic vertebrae with intervening intervertebral discs. These are basically the skeletal elements of the thoracic wall اللي نسميه thoracic cage. The first skeletal element of the thoracic cage is the thoracic vertebra. قبل أن نشرح تفاصيل thoracic vertebra, خلينا نشوف what are the general features of the vertebra in general. Each vertebra composed of anteriorly the body and posteriorly the vertebral arch قوس الفقرة. The arch has two parts. The first part is called the pedicle. هذا الجزء الأصفر من الvertebra نسميه pedicle اللي يتصل لي بالbody on the posterior aspect, and a plate of bone called the lamina. واللامينا معناها plate of bone صفيحة عظمية. بمنطقة اتصال pedicle مع اللامينا I will have a transverse bony process نسميه transverse process of the vertebra. Posteriorly طبعا on each side of course. At the point of meeting of two laminae from each side, I will have a posteriorly directed spine-like bony projection نسميه the spinous process. والspinous process بترتيب الvertebrae one above the other هم النتوءات اللي أنا أحسهم من أمد إيدي وأتحسس posterior part بالmidline of the back. هم ذول spinous processes. بوجود البادي مع vertebral arch راح أحصل على vertebral foramen. With the arrangement of overlapping vertebrae one above the other, مجموعة الفورامينا راح تتحول إلى canal نسميها vertebral canal أو the spinal canal, through which the spinal cord and its coverings of course will be housed هنا. Now back to the thoracic vertebra. Thoracic vertebrae according to certain features are classified into typical and atypical vertebra. المطلوب من عندك شنو؟ أنك تعرف الفيتشرز of the typical vertebra وتعرف الاتيبيكال vertebrae. فأنت عرفت الاتيبيكال البقية كلهم typical vertebrae وعرفت الفيتشرز. What are the features of typical vertebra؟ هم التالي. First, the shape of the body is heart-shaped from superior aspect, superior view, with the anterior, posterior and transverse diameters are almost equal. تقريبا تشابه المسافة anteriorly والtransverse. The vertebral foramen is almost circular. This is regarding the shape. Now, the body has 4 demifacets. وديمي يعني partial facets, more complete facets, and we will know that. We will know why. 2 on each side. عندها 4 demifacets. 2 بكل صفحة. بعد عندي طبعا articular. The pedicle has superior and inferior articular processes to articulate with the vertebra above and below. The transverse process also has a facet, articular facets, to articulate with the corresponding rib. فذول هم typical features. شنو دور demifacets on the body? Each rib has a body, has a head that articulates with the vertebra, with the corresponding vertebra. يعني 7th rib articulates with the 7th vertebra, thoracic vertebra, and the vertebra above. كل vertebra has, or vertebral body has 2 demifacets on each side. The superior facets articulate with the corresponding vertebra, with the head of the corresponding vertebra, while the inferior facets articulate with the heads of the rib below, corresponding rib. Superior facets articulate with the head of the corresponding rib, while the inferior facets articulate with the rib below. يعني if this is a 7th vertebra, هذه inferior facets articulate with the 6th rib. So, atypical vertebrae هم التالي. First, the T1 vertebra. ليش؟ Because the superior facets احنا نعرف انه T1 vertebra above it is the C7 vertebra. The T1 has a complete articular facets, مو demifacets. مو demi يعني نصف. مو demifacets. The first rib articulates with the superior thoracic with the superior facets completely, does not articulate with the vertebra above. فالسuperior facets بالfirst vertebra has a complete facets وليس demi facets. فخسرنا واحدة من الصفات اللي تسويها typical صارت atypical. T1 is atypical. T10 and often T9. Why? Because it articulates with related ribs only. يعني ما عندها articulations with the rib above or below. يعني T10 rib articulates only with 10th thoracic vertebra. So T10 is atypical vertebra and more often with the T9. T11 and T12 only articulates with the head. Now, each vertebra has 2 articulations with each rib. راح 3 articulations with the head and with the tubercle. And we will see when we will discuss the articulations, we will see the articulations. T11 and T12 articulates only with the heads, with the body. ما عندهم articulations ويا the transverse process, because the transverse process also has a facet for articulation. The second skeletal element of the thoracic cage is the sternum. The sternum is a flat bone composed of 3 pieces. It lies on the anterior aspect of the thoracic cage. The upper piece, or the upper parts of the sternum, is called the manubarium sterni or the manubarium of the sternum. Manubarium يعني handle. It is the broadest quadrangular part of the sternum, composed of 4 borders. The superior border is notched, B-notch, called the jugular notch or the suprasternal notch. وهذه النوتش هي اللي تقدر تحسها بأعلى الأمام من منطقة الثوركس أو بأسفل منطقة النك. This is called the jugular notch or the superior suprasternal notch. هذه المنطقة إذا رجعنا posteriorly على الvertebral levels مالتها راح نشوفها تقع level of T2, T3 intervertebral disc between the second and third thoracic vertebra. هذه levels مهمة تعرفها. Then at these levels, different levels, راح يصير many events of the anatomical structures. راح يصير relations of one structure to another at these levels. Now on each side of the jugular notch, I have a large articular facets for articulation with the medial end of the clavicle to form the sternoclavicular joint, the الذكر من upper limb. On each side, lateral sides of the manubarium sterni, I have a larger facets for articulation and attachment of the first costal cartilage, the costal cartilage of first rib. الضلع الأول راح يجي يتمفصل بهذه المنطقة. On the lower aspect of lateral or sides of the manubarium sterni, I have a demifacets for articulation with the second costal cartilage or the costal cartilage of the second rib. Now, the lower border is articulating with the body of the sternum. The manubarium sterni does not lie at the same plane. It is angled over the body. This is the body of the sternum. بنشوف إنه المانوبيريوم sterni بangulation, inclined posteriorly, رايح posteriorly on the plane of the body of the sternum. فهنا راح يخلق لي an angle. الانجل اللي صار between the manubarium sterni and the body of the sternum. This angle is called the sternal angle or manubariosternal angle, and sometimes called the sternal angle of Louis. Louis عالم فرنسي تنكتب L-O-U-I-S. S is silent فتنلفظ the sternal angle of Louis. This angle is very important landmark, surface landmark in the thorax, and we will discuss why. The body of the sternum is a narrow part, narrower than the manubarium sterni. It has an anterior subcutaneous surface with transverse ridges. هذه transverse ridges هي مناطق الفيوجن of the four pieces of the sternum. During embryological development, the sternum composed of four pieces. هذه pieces نسميها sternibri. With development, with advancing age, هذه pieces will fuse, forming the body of the sternum. A line of fusion راح تصير as transverse prominent ridges on the anterior aspect. On each side of the body of the sternum, I have four complete facets, articular facets, to articulate with the third to sixth costal cartilages, and two demifacets on the upper and lowermost part of the lateral aspect of the sternum. The superior demifacets, inferior demifacets of the manubarium sterni will articulate with the second costal cartilage, while the inferior demifacets with the demifacets of the xiphoid sternum or xiphisternum or xiphoid process of the sternum will articulate with the seventh costal cartilage or the costal cartilage of the seventh rib. So this is the sternum in summary. احنا قلنا انه المانوبيريوم sterni is angled over the body, has an angle اللي سميناها sternal angle of Louis or manuberiosternal angle or sternal angle للسهولة. هذا sternal angle we can palpate it إذا ننزل من الjugular notch وننزل inferiorly, because the manuberium sterni and the sternum is subcutaneous. راح نحس elevation بعدين a depression. We will feel an angle. هذه الانجل اللي هي سميناها sternal angle. من الانجل إذا رحنا laterally راح نحس ال second costal cartilage, ولا more laterally راح نحس ال second rib. فال sternal angle, it is a landmark, surface landmark to guide the physician to count the ribs. حتى نقدر نحسب الربس احنا ما راح نقدر نحسب من الفيرست rib. يعني as you remember, the first rib is covered by the clavicle and is completely obscured by the soft tissues surrounding the first rib. We cannot count from the first rib. احنا ايش بدنا نحتاج نسوي counting حتى نعرف structures beneath the thoracic wall. نريد نسوي عملية، نريد نسمع الهارت، نريد ندخل نيدل لأي سبب كان، نريد نسوي ايكوكارديوغرافي للقلب. لازم نعرف احنا in which intercostal space، بيا فراغ اللي هو between the ribs intercostal spaces. فلازم نحسب، لازم نعرف احنا at which rib at which intercostal space. شلون نحسب؟ راح نحسب نحس sternal angle، نروح laterally this is the second. السبيس اللي above the second rib هو first intercostal space، والسبيس اللي below the second rib هو second intercostal space، والربس اللي جوا هو الثالث والرابع and etc. The sternal angle is one of the most important surface landmark in the thorax. On the other hand, if we go posteriorly and we draw an imaginary plane, خلينا مستوي imaginary plane from the sternal angle transversely into posterior part, level مال sternal angle راح يوازي intervertebral disc between the fourth and fifth thoracic vertebra. هذا جدا مهم تحفظه، لأن at this level of this plane بهذا المستوى many events will occur inside the thoracic cavity. Why events؟ راح ناخذ بالتفاصيل اللي هو نسميه the sternal angle plane or the plane of the sternal angle at vertebral level, intervertebral disc between T4 and T5. The last skeletal elements of the thoracic cage are the ribs. We got 12 ribs on each side of the thoracic cage. Each rib is articulating posteriorly with the thoracic vertebra and is attached anteriorly to the sternum through a costal cartilage. The rib anteriorly attached to the sternum indirectly through a cartilage called costal cartilage. Type of this cartilage is hyaline cartilage, مثل ما أخذناها بالintroduction. Now, to study the ribs, we have two types of classification. The first classification, ونقسم الرibs according to their attachment to the sternum. Any rib that attached to the sternum through an individual costal cartilage, كل rib attached to the sternum individually وحده نسميه true rib. فعندي أول سبع أضلاع, first 7 ribs are true ribs because they attached individually through costal cartilages to the sternum. From 8th to 12th ribs are called false ribs. Then from 8th to 10th those attached indirectly to the sternum through the costal cartilage of 7th rib, while the last 2 ribs they don't attach to the sternum at all. بنسميهم floating ribs because they are floating طايفات بالmuscles of the anterior abdominal wall. The lower border of the costal cartilages of mainly of 10th rib واللي تصعد باتجاه sternum, هذا الجزء هذا الأحمر lined with red line ونسميه costal margin. Costal margin is the second most important surface landmark احنا نقدر نحسه, وتقدر تجرب هسه تحسه على الكوستال مارجن مالتك يمتد من ال lower part of the sternum باتجاه الابدومن obliquely downwards and laterally ينزل. This is the costal margin. مثل ال thoracic vertebra عندنا another type of classification نسميه typical and atypical classification. Likewise to the thoracic vertebra راح نقسم الربس إلى typical and atypical, والمطلوب again من عندك إنه تعرف شنو ال features of the typical vertebra, وهنا راح تعرف منو ال typical vertebra مو ال atypical, بالعكس يعني هنا أسهل الموضوع. احنا بالvertebra عرفنا من ال atypical والبقية هم تحصيل حاصل راح يصيرون typical, وهنا بالعكس راح نعرف ال typical والبقية هم atypical. What are the features of the typical vertebra? The typical rib. The typical rib is long bone. It has a curved shape. Posteriorly, the most posterior part is called the head. Expanded end of posterior end of the rib is called the head. The head articulates posteriorly with the vertebra. It has 2 articular facets. The superior facets articulate with the vertebra above, while the inferior large facets, superior is small, the inferior is large, articulates with the corresponding vertebra. Between the 2 facets, I have a crest. هذا crest يتمفصل مع intervertebral disc. يعني أنا عندي هنا vertebra, body of vertebra, واللي جوا عندي another body of vertebra. هذا الكريست يتصل بالintervertebral disc. If I go laterally, I have a slightly constricted region نسميها the neck of the rib. وبعدين المنطقة الأخرى اللي راح شوية تروح posteriorly نسميها the tubercle of the rib. Tubercle بها 2 parts. Articular part اللي بها articular facets to articulate with the transverse process of the vertebra, و non-articular part اللي هو راح يكون attachment for ligament. Then I goes laterally and slightly anteriorly. هذه المنطقة راح يصير بيها angulation of the rib نسميها the angle of the rib. هذه المنطقة when somebody lies flat on a surface هي هاي المنطقة اللي راح يصير in direct contact ويا الفلور ويا السيرفس. هذه المنطقة تكون thick resistant to fracture لأن كل الوزن مال الجسم راح يكون عليها. الرب طبعا بالكروس سكشن راح يكون flat from inner and from external and internal surfaces، فراح يصير بي twisting along the longitudinal axis، راح يفتر حول المحور الطولي مالته وبعدين يرجع يصير anteriorly إلى أن يوصل إلى الكوستوكوندرال، يسمى كوستوكوندرال junction هذه المنطقة، وبعدين راح يتصل ب coastal cartilages، coastal cartilages ب slight upward course ويتصل بالsternum. الرب ب internal surface and external surface. فالinternal surface بال posterior aspect راح يكون anteriorly directs anteriorly، while in the anterior aspect راح يكون posteriorly. هذا صار عندي twisting، افتر حول المحور الطولي مالته. هذه هي ال features of typical vertebra. من هم typical vertebra؟ هم 3rd to 9th vertebrae. ال first وال second وال 10th وال 11th وال 12th هم ذولا atypical vertebrae. راح نشوف ليش هم atypical vertebrae. بالcross section الvertebra عفوا الرibs has a superior border, smooth and wide rounded border, and sharp, more sharp طبعا than the superior inferior border. On the inner aspect of the inferior border I have a groove that extends along the entire length of the rib نسميه coastal groove. هذا الcoastal groove راح تمشي النيوروفاسكولار باندل اللي هم intercostal nerves, vessels and lymphatics اللي راح ناخذهم بالتفاصيل المحاضرة القادمة. These are the atypical ribs. بنشوف أول شيء ال first rib. First rib يكون flattened from superior and inferior. ما بي external and internal surfaces. This is number one. The head be single articular facets. ما بي two articular facets. Be neck be tubercle. It is short and broad. The superior surface of the first rib has grooves and elevations and roughness. The grooves, the anterior groove is for the subclavian vein. إذا نتذكر above the first rib راح يمر subclavian vein يروح للأكزيلا، يمر بالأكزيلا وبعدين الupper limb، و posteriorly عندي groove for the subclavian artery. بيناتهم راح يصير عندي شيء اسمه scalene tubercle اللي هو attachment for the anterior scalene muscle. وبعد عندي attachment for the middle scalene muscle. هذه muscles تجيني من النك و attached to the first rib. هذا بالنسبة لل first rib. The second rib is also a typical rib because first it is short, although it seems to be longer than the first, but it is still shorter than the typical rib. Also has a superior and inferior surfaces, and it is atypical. This is the 12th rib. It is short. طبعا again the head of the second rib has only single articular facet. This is the 12th rib اللي هو atypical rib, false rib and floating rib. هاي كلها تسميات أو classification for the 12th rib. It doesn't have an anterior attachment to the sternum. This shows the articulations of the skeletal elements of the thoracic cage. As we can see here, the head of the rib is articulating with the corresponding vertebra. هذا هو fifth rib. This is the fifth rib. So it articulates with the fifth thoracic vertebra and the vertebra above اللي هي fourth thoracic vertebra, and also has articulation with the transverse process through the tubercle. Anteriorly, it has an individual articulation with the sternum through the costal cartilage. The articulation between the head and the head of the rib and thoracic vertebra called costovertebral articulation. each rib has 3 articulations with the vertebral with the thoracic vertebra. شلون 3؟ الhead B2 طبعا typical. We are speaking about the typical rib and typical vertebra. The head of typical rib has 2 articular facets that articulates lower facets, inferior facets articulate with the corresponding vertebra, يعني نفس الرقم الرب, where superior facets articulates with the inferior facets of the vertebra above. فهذه 2 articulations, وهذه الارticulations هي basically synovial variety of joints. The crest إذا تتذكرون between the 2 articular facets articulates or joined with the intervertebral disc through an intra-articular ligament. When we go posteriorly and laterally, the tubercle of the rib articulates with the articular facets of the transverse process. فهذا نسميه costo-transverse joints. هذا كان costo-vertebral articulation, هذا costo-transverse articulation, وهنا نشوف ال non-articular part of the tubercle of the rib gives attachment to the superior and inferior. طبعا in the inferior costo-transverse ligament, and the strong ligaments اللي يبقي لي ribs attached to the vertebrae. Anteriorly, articulations between the costal cartilages and the sternum are completely synovial joints except the first rib. Keep in mind, the first rib is articulating through the costal cartilage into the sternum via a fibrocartilaginous joint, so it is not a synovial joint. While the articulation between the manubrium sterni and the body of the sternum is through a secondary cartilaginous joints اللي هو نسميه symphysis, مثل symphysis pubis. It has a very slight movement, if any. We have another types of joint of articulations اللي هو between the costal cartilages of the false ribs, يعني من ال 8th لل 10th. هذول نسميهم interchondral joints, and again they are synovial joints. The joints between the body of the body of the sternum and the xiphisternum that we forget to discuss about it. It is a small piece of bone, triangular or pointed downward. Joints between the xiphoid sternum, xiphisternum or xiphisternal joint is also a symphysis, likewise the monobariosternal joints. The last subject in this video is the breast. And the breast consists of mammary gland that is embedded in the superficial fascia of the associated skin in front of the pectoralis muscle in the region of the anterior thoracic wall. It extends from the 2nd to 6th rib and from the lateral part of the sternum medially to the mid-axillary line on the lateral aspect. The breast is basically composed of the mammary gland, which is modified sweaty glands. Each mammary gland is divided into 15 to 20 lobes, قسم إلى lobes. From each lobe, a duct called the lactiferous duct is being emerged. هذول الducts اللي هم 15 to 20 ducts, they converge تتجمع just beneath the skin. Each duct gets expanded, تسوي لي شيء اسمه lactiferous sinus. Lactiferous ducts أو lactiferous means milk. And each sinus opens individually into a thickened part of skin called the nipple. The nipple is surrounded by a pigmented circle of skin. It's pigmented يعني متصبغة, نسميها the areola. Now the breast, the base of the breast, الجزء اللي هو attached to the anterior thoracic wall, to the pectoral region, just in front of the pectoralis major, is separated from the deep fascia of the pectoralis major muscle by a loose connective tissue نسميه retromammary space أو submammary space. This space permits slight range of movement of the breast overlapping over the pectoralis major and anterior thoracic wall. The connective tissue that separates the lobes of the mammary gland in some regions gets thickened. هذا connective tissue تصير thickened septa. هذه السبتة supports the shape and suspends the tissue of the breast. تعلقة فنسميها suspensor ligaments of the breast. تمتد من the dermis of the skin posteriorly into the deep fascia of the pectoralis muscle. هذه تعلق البريست فنسميها suspensor ligaments. What is the significance of the suspensory ligament of breast? مثل ما تعرفون breast undergoes cyclical hormonal changes alongside the menstrual cycle. The menstrual cycle, one of the organs that undergoes these changes will breast. فهذه الchanges تخلي عرضة إلى breast cancer. Breast cancer هو most common cancer among female. من يصير عندي breast cancer هنا وراح تحول إلى ماس إلى كتلة. هذه الماس ممكن تأثر لي على suspensory ligaments of the ovary. ممكن يصير بها contracture يعني تقصر. فش راح تشد؟ راح تشد منطقة بالسكن تؤدي لي إلى what's called the dimple كأنه انبعاج أو petting يعني انبعاج أو كأنما واحد هنا دايس. فهذه petting تعطيني indicator إنه there might be a cancer, there might be something wrong within the breast due to the affected suspensory ligament of the breast. طبعا sometimes يكون fixation of the breast ما عندي هذا الموفمنت اللي يصير بالretromammary space due to invasion of the cancer into the posterior thoracic from the posterior aspect of the breast. It's very important to understand the blood supply of the breast because as we already discussed, the breast is an important site for cancer in female. Sometimes we need to remove part or whole the breast as well as طبعا إذا أكون lymph nodes أكيد. Surgeons should have solid anatomical knowledge of the blood supply حتى when we remove the breast نعرف when the blood supply of the breast and remove it. The blood supply is divided into medial half and lateral half. The medial half is basically supplied by branches from the internal thoracic artery. Internal thoracic artery هو branch من subclavian artery. It runs deep to the anterior thoracic wall. It runs in a longitudinal course يمشي longitudinally just lateral the sternum. يعطيني penetrating branches that penetrate تخترق لي intercostal space توصل للmedial half of the breast. Laterally, it's supplied by the branches from axillary artery. And as you may remember, the axillary artery has many branches. 4 of them اللي هم thoracoacromial artery gives pectoral branches تروح للmedial side of the breast. So, عفوا lateral side. يعطيني lateral thoracic arteries, superior thoracic artery, and the pectoral branches from the suprascapular arteries. Other arteries come from the intercostal arteries of second to fourth intercostal spaces. Intercostal spaces, second to fourth, posterior intercostal arteries, from posterior aspect. Branches also, it pierces the intercostal spaces, overlying the lower border of the pectoralis or lateral border of the pectoralis major muscle. توصل للlateral aspect of the breast. مهم نعرف شغلة ثانية اللي هي breast has a process that's called the axillary tail or axillary process that extends into the lateral border of the pectoralis majors and go within the axilla. ممكن it reach to the axillary apex, to the first and second rib. The venous drainage is parallel to the arterial supply. Eventually ممكن it follows the medial branches medially to the internal thoracic vein, and also it drains back to the axillary vein, or it follows the branches of the intercostal arteries to be drained into the intercostal veins of second and fourth intercostal spaces. Lymphatic drainage is the most important subject of the breast because breast cancer again might be spread through the lymphatics, so it is important for a physician when examining a breast, it is mandatory to examine the lymph nodes, especially the axillary and supraclavicular lymph nodes. من نفحص lymph nodes, من نفحص breast عفوا, لازم نفحص lymph nodes. Very important and very critical. شلون نقسم lymphatic drainage of breast؟ نقسمها إلى 75% of the breast, especially the upper lateral aspect of the breast, is drained into the anterior axillary group, or called the pectoral axillary lymph nodes, pectoral group of axillary lymph nodes. Some of the lymphatic drained into the apical group of the axillary lymph nodes. The remaining lymphatics, which is about 25% of the breast tissue, especially the medial and lower medial aspect of the breast, is drained into the parasternal lymph nodes. هذه هي parasternal lymph nodes that are associated with the internal thoracic artery. The lymphatic drainage of one breast is connected to the lymphatic drainage of the other breast. So this is again a very important point. Sometimes we might have a cancer in one breast that spread to another breast. لهذا when we examine one breast in a patient, we have to examine the other one, looking for any problems in the other breast. Some of lymphatics could go to the abdomen, to the liver on the right side, and to the abdominal lymphatics. لهذا ممكن يصير عندي spread للأبدومن، ممكن يصير عندي spread إذا cancer of the breast spread to the liver, spread to other contralateral breast, or spread to the lymph nodes. It's very important to identify the lymphatic involvement in breast cancer because the identification of lymphatic involvement defines what's called the staging of cancer. احنا لازم نسوي staging للكانسر حتى نحدد الخطة العلاجية، نحدد المريضة ممكن شلون راح تتعامل وياه، نحدد فشي اسمه البروجنوسيس، ايش قد نسبة تحسن، ايش قد نسبة لا سمح الله الوفاة، ايش قد نسبة المضاعفة إلى آخره. So it's very important to identify and define the staging of the primary cancer. طبعا this applies on all cancers, but specifically we are talking about the breast cancer. Innervation is through the ventral rami of the spine, of the intercostal spinal nerves. Nipple, طبعا from 2nd to 6th intercostal nerves. The nipple is supplied by the T4 intercostal nerve. This is the end of today's video. Thank you very much.